Hi, I'm Dr. Jeffrey Antimarino from Bellissimo Plastic Surgery and Medi Spa. I'm sorry we had some technical difficulties, so we are back live. So tonight, this is a very special event. We've done this is the second time now, and every month I tell you it's a very special Facebook Live because I like to do them. But tonight we're going to be talking to some ladies that are breast cancer survivors, and I'm going to be talking to Dani from Our Clubhouse, and I'll introduce her in a minute, and to Dr. Sharon Goldstein, who is a renowned breast cancer surgeon, and she and I are working together a lot, so I'm going to have Sharon talk a lot about breast cancer, the genetics behind it, and any other questions that you have. So tomorrow, just so you know, is National Bra Day. That is Breast Reconstruction Awareness. We'd like you to get involved with this. It turns out statistically only about 25% of women that contract breast cancer are even told about their options for reconstruction. Anybody that knows me, I try to get out there, and my platform is that I think every woman should at least hear their options about breast cancer or breast reconstruction. They don't have to have the reconstruction, but I'd like them to at least have the information so they make the best choice for themselves. So without further ado, let's get on with tonight. This is a great night. We're going to be talking to ladies that have survived breast cancer and what it was like for them to go through it. So any questions that you have, please type them in. We'd like to answer any of the questions. So to my meet, all the way down to the end here is Jamie. Jamie is a breast cancer survivor. She developed breast cancer under the age of 30, which is very rare. And I want her to kind of go through what that meant to her. And at such an early age as well. It's not ever a good time to get cancer, but at age 30 or under 30, there's a whole life ahead of her that she, that was going to be dealing with something. Mindy is in the middle. Mindy was here with us last year. Mindy is also a breast cancer survivor and post-reconstruction. She did such a great job last year talking about her trials and tribulations that we wanted her to come back again this year. To my immediate right is Sherrie. Some of you know her because she works with us now, but she's been a patient of mine for a long time. Breast cancer survivor of 10 years now.
Right.
So congratulations. And so I wanted you to hear from her. To my immediate left is Dr. Sharon Goldstein. Sharon's been with Westmoreland, or the Excela program now 8 or 9 months?
Yeah. Mm-hmm.
So this has been a great addition to Westmoreland. I can tell you, she and I have been teaming up to do some surgeries together. Not only is she a very good surgeon, very talented, but she's a really good doctor. She knows a lot about breast cancer. She's got a great bedside manner. So we asked her to come on tonight because I think she's such a special person that I think she can put it out there to you that takes away some of that anxiety and the fear of breast cancer, and she may be able to shed some better light for you. To her left is Lurie, and anybody that tuned in last month, we had a lot of fun talking about her company, Cancer Be Glammed. Lisa is also a breast cancer survivor, and she and her friends started Cancer Be Glammed, and this is about different outfits and information about whether you're going to go through any type of cancer, things that you may want to bring with you, things that are outfits that you can wear to radiation, outfits if you have drains that you can kind of tuck them away and hide them. So she can go through some of that. It was so interesting and such great information. Last month we had a lot of feedback, so we asked her to come back and be part of this. Lastly is Dani. She's the executive director of Our Clubhouse, which is a very special group that really gets behind any type of any type of cancer, not only breast cancer. But Dani's a special lady that we've gotten to know over the last several months, and I'd like to kick it off with Dani. So Our Clubhouse is a very special organization, and I want you to kind of let us know a little bit more about it.
Sure, thank you. Thanks for having me here. I'm excited to hear everybody and learn more about your story. I did watch last year, Mindy, so I'm ready for the update. So Our Clubhouse has been in the Strip District for 12 years, and we also have a location in Greensburg. We've been there 3 years, and we provide programs and activities and support for anybody touched by cancer. That's folks with a diagnosis as well as friends and family that care for them. Because we know that when cancer happens, it happens to the whole family. And no one should face cancer alone. So we offer clinical support. It includes support groups, individual counseling. We have health and wellness classes like yoga, oncology massage, Reiki. We offer nutrition, we cook for members, we have social activities, we have a really thriving family and youth program. Some of the children come that have a cancer diagnosis, but a lot of the kids are touched by cancer in their family. And everything that we offer is free. We're a nonprofit that relies solely on the generosity of our partners, including Bellissimo and individuals. So thanks for having
I'm reaching
us.
for my checkbook.
Fantastic.
Yeah, it is a great organization. So, visit their website and really try to get involved. I'd like to kind of kick it off. I think I'm going to wait till the very end for Jamie, because you're new and I want you to kind of settle in and let us know your story. But Mindy, why don't you start, and then we'll go to Sherrie, and then we'll pop back to Jamie, and just tell us a little bit about your story again, and what made you, as you went through everything, and how your decision was not only just to go through the reconstruction, but you decided, for both sides, and how you came to that decision.
I was diagnosed 11 years ago. I was 48. I had a lump on the left side, and they were only going to take one breast. So a week or so before my surgery, the doctor called and said that they saw something on the right side. He wanted to postpone the surgery, and freaked out because I was ready to go and ready to have this done. And after talking to a good friend of mine who had had 2 mastectomies at different times, I said to her, "Janie, what should I do? What would you have done?" She said, "Just have them both." And I said, "Can I do that?" Because no one ever told me that was an option, which was very difficult. Once I decided that, fine, I'll just have both of them done and it's gone. I was a lot more at ease about having the surgery. The mastectomy itself, to me, wasn't a big deal besides looking at the site after, they were gone. I had to wait 18 months to have my reconstruction, and as Dr. Antimarino knows, it was very extensive. I had what they call a lap flap. They took muscle and tissue from my back to replace anything that was in the front, and implants, and I think I've gone through 4 or 5 surgeries since. We ended up putting alloderm in. Gentleman from the company is here, so he gave me $50 to say that. But, and it's been great since. I'm very symmetrical. The one thing I would offer to people, if they do have the reconstruction, is to have the tattooing done. It was very important to me to look as natural as I could look and not look at scars. And that was very, very helpful to me. I would hope it would be helpful to other people. And I'm 11 years out and doing good.
And that's the thing that's changed over the years is I think women have gotten very aggressive about doing both sides, even with cancer on one side. So I'm seeing it as a reconstructive surgeon, but I was going to ask Sharon, how often are you seeing that now, and how do you counsel patients on it, or do you allow them to bring it up?
So about 25% of women with breast cancer will get a mastectomy, should have a mastectomy, and 75% really can have breast conservation surgery. The choice to have both breasts removed, it's very complicated. I will bring it up, particularly with younger women. Sometimes women make that decision because they're worried about developing cancer in the other breast. In fact, that risk is low, and there's no improvement in survival for doing both sides unless someone is a carrier of one of the BRCA mutations, the BRCA mutations. So there's no change in survival overall. However, a lot of women have so much anxiety having to do with that remaining breast. They start to hate that breast, and they can't tolerate it. And so it's really that person's choice. And I don't try and discourage or encourage. I just lay out the facts and the statistics, and our patients are intelligent, and it's their bodies, and they need to decide what's best for them.
Right, and I think that's, the way you said that, that's what I've come to, one of the things I've come to love about you, because you do put it out there. It is their body, it is their choice. When it came to me, I was still practicing in California, and I was probably only in private practice, I think maybe 3 or 4 years. It's been a while, and maybe 14 years ago. And a young lady came in to see me. She was only about 35 years old, and came in just very businesslike. This was just sort of matter of fact. I had breast cancer. And so I started talking to her about reconstructive options, and she says, well, I'm doing both sides. And I said, well, I'm not sure why you want to do that. The studies show this, and the studies showed that, and and the same thing. There really wasn't any reason to do both. And she looked at me straight in the eye, and she says, I'm doing both because I'm only 35, and I don't want to go through the rest of my life. Every time I get a twinge of pain or something in that other breast,
Exactly.
I don't want to be worried about it. I don't want to keep thinking I got to go to the mammogram next year. And what if this? What if that? I said, yeah, but the chances are still low. She said, but I don't even want to deal with that. And then that's when it hit me, and I just said, I get it. I feel the same way, because really, my job on the team as the plastic surgeon is to try to give the quality of life. Your job is to give quantity, the length of time. You're there to get rid of that nasty thing that's killing somebody. And the oncologic doctors, they're there to extend your life as well. I don't do any of that. But I try to, or as a plastic surgeon, not just me, but all plastic surgeons try to restore that sense of fulfillment, that femininity, and give that quality of life back. And that lady was the first one, and I've never looked back. I just said, I get it. I mean, so I'm on board with it. So I don't really bring it up too much, because a lot of women sort of have decided. There's been a couple of ladies I've sort of brought it up to. Again, they were younger, and I said, would you consider it? But I just wanted to see how your take on it. So again, it really, the take-home message, at least for what I'm getting, is, we're supposed to, as doctors, give you the information, all of it, in the clearest possible way, so that you can think about it, and you have time to think about it. It's not like you have to be there the next day, but in a reasonable amount of time, make the best decision for you and where you are in your life. And we see a lot of young ladies, and a lot of them have kids now. And when I was first starting on general surgery, most of those women were 55 to 70 was the average age. And now the majority of women I see are 35 to 45. And then with I have 3 ladies that are under the age of 30 when I first met them. So it's a much different disease from when I was going through general surgery residency, and you've seen it in your career, I'm sure.
And a much more common disease. We're seeing more and more breast cancer all the time. But the good news is the survival from breast cancer is increasing all the time. So in the last 20 years or so, the survival's increased by 40%. That's several 100,000 lives we're talking about. So I think there's a lot to be hopeful for. The other issue actually is symmetry.
Mm-hmm.
If a woman has a mastectomy on one side, with or without reconstruction, she's still asymmetric. It's very hard to match, the breasts, and I think that, especially with larger breasted women, so that's a big driving force.
From a selfish point, from the plastic surgeon, both sides is easier, because for us, we always say symmetry is everything in plastic surgery. So for me, to be able to give symmetry is a lot better. But again, you do what the lady is best for them.
Right.
But again, we have an 11-year survivor. Jamie, how far out are you?
9 years.
9 years. We have a 10 years. So we're not even batting an eye now. I mean, and before 20 years ago, that was a milestone. Not to diminish that, but and the medications that you're all taking, and I mean, you're living good quality lives now. So it's something that maybe we didn't have more than 20 years ago. So go next. Tell us.
Okay, I will.
Go ahead.
So 10-year survivor, and like Dr. Goldstein said, I was so blessed to have a team. You were on that team, that I was given all the information, where so many patients aren't even giving, and it's so sad, because there's so much out there to help us to get to where we need to be. And I remember Oh, you make me cry. Because the hardest part is the unknown, not knowing what's to come. And I remember coming to see you, and as soon as I left that office, I said to my husband, it was immediate. It really was. I felt like a ton of bricks was lifted off me because I knew what the plan was, and I felt comfortable with that. And I have an identical twin sister, but we're talking about the BRCA test. And I said, I have to have the test. My doctor actually suggested that. She said, you're twins, you should have the test to see if she would have it. And I was negative with the test, so I chose not to have the double vasectomy, which I thought about. And that's a really tough, God love, because that's a tough decision. And as a woman, your breast does not define you by any means, but it's part of who you are. And when you walk past the mirror, it's just what you see. And when somebody like you comes into the picture, it can make you whole again. It's life-changing, really is. Okay, I'm not gonna cry, stop it.
I just want to say we're getting a lot of,
I didn't get $50.
we don't have Alabama. There's a lot of comments about the beautiful, strong women that are on camera tonight. So I just want you to know there's a lot of comments that we're hearing talking about saying hi to you, Dr. Goldstein.
That's nice.
Connie says, this is also a great opportunity to hear the doctor's perspective on the process. Thank you for your time and helping women with this very difficult and scary process. So thank you, ladies, for your time.
All right, Jamie, you're up.
So I'm 9 years. I knew I had a lump, and I was very naive because I was only 26 years old. It couldn't happen to me. Didn't run in my family. I was very small-chested. Nope. My dog jumped on me and went to the doctors, and 2 weeks later it was all doctor's appointments, and that was one thing I was very blessed with. It was amazing, amazing doctors. Because 26, I didn't know what to expect. Meeting him for the first time, and just like she just said, me and my dad left that room, and I felt at ease. So surgery day, he comes in and works me all up, and it was the start of a new chapter. Now, like Mindy said, she wanted both gone. I was 26 and I did get a second opinion, and McGee Hospital wanted me to have both. 26, I wanted to keep me. You're taking one, so I kept one. But now it's a struggle looking in the mirror, and because I didn't go through the tattoo or nothing. But now I go every 6 months to get this side checked, and it's scary. But you know, the doctors did tell me I wouldn't be able to have kids, and I have twins, so I'm very, very blessed. That just turned 3. So it's been a hard road, but with someone like Mindy beside me, it's easy. So.
And that's the other amazing thing about the breast cancer groups is there's a lot of survival support groups, and I always encourage patients to get involved with them because women are their best advocates, and you know, which is completely different than men. And I joke with ladies, and you guys have probably all heard this before, but you know, women really rally around each other, and the breast cancer support walks, the runs, everything is very well accepted, very well received, and it's fantastic. And a lot of ladies, you know, once they hear that, they're just, you know, like a deer in the headlights. They, you know, they got this diagnosis. They've been running through doctors. It's just coming at them, and they're just in the fog. But to go through all of this, and you know, and I get to know each one of them because we see each other so often, that to watch that transformation, how strong they become, that actually they turn around, and some of the patients I've been through at the beginning that were just holding on have become the biggest advocates, and you know, sort of that bastion for other women to come and talk to. And I know Mindy had a support group, and she's always been there to talk to other ladies. Sherrie's the same way, a lot of patients that come through the door. And it's amazing to see that transformation, that you go from somebody who's just, your whole world's been turned upside down. You don't know what's coming next. You got all these doctors telling you you're having this and that, and we're going to prod you and poke you and inject you with things. To somebody who's saying, hey, you can do this. I've done it. We've done it. You know, and you've gone on. Now you have kids and twins, and you guys are back. You know, it's amazing to me. I'm just amazed. I'm just happy to be part of it because it's really rewarding for me just to be part of that whole transformation, whether I do the reconstruction or not. It's amazing how strong women are. Guys, we just sort of go in the shell. There's not really any prostate cancer walks. Guys don't want to deal with it. We don't want to talk about it. So, but ladies, get out there and help each other.
Breast cancer.
Yeah, there is.
And you can't forget that.
Right. Yeah. So, Lisa, tell us your story again, because we were talking about different things that people do. People that offer reconstruction, both sides, one side. You didn't offer a reconstruction at all.
I'm flat.
And it's just
and fabulous.
but there's a lot of ladies are choosing that, and
that's
that's a good
exactly
option
right.
for some women.
That's not to steal patience from you.
No, this is and I asked Sharon to be here for those reasons. This isn't about
Yes, I
getting
know.
patients into this.
True,
This is
right.
really just
True.
about letting you know from all walks of life
Yes.
why you chose, why it worked for you, so women can kind of feel like it's okay. I think sometimes we feel like you go in and the doctor's telling you can't do this, and I've had patients come in and say the doctor told me I couldn't have reconstruction for 5 years. It's garbage.
Yes.
You should know what your
And
options are.
that's the key to everything. I mean, I think had I had somebody like you in my life then, Jeff, my choices and choice might have been different. I was diagnosed with cancer 10 years ago, lots of long-termers here, and I had 2 weeks between my call from the doctor telling me I had cancer and my surgery. So during that time, I had 2 young daughters, my husband, I was working, and it was such a hectic time. And so I think, and the first reaction to it needs to be is what is gonna happen to me medically? What treatments do I need to have, follow-up, et cetera, the surgery, getting the surgery planned. And I felt like I had excellent medical advice, and I was running around, going to different doctors, getting a second opinion, as I think most women should. But I had very little input on, now this was 10 years ago, on what my surgical options were for reconstructive surgery. And I stayed up all night one night, and I kept agonizing, what should I do in reconstruction, who should I bring in, et cetera. And in the end, I realized that it was too tough a decision without the facts. It was too tough, and even back then, you didn't have the internet quite the same way. You didn't have terrific doctors who want to make sure that people know what their options are. And so, like, I stayed up all night, and when my husband woke up in the morning, I said, you know what? I'm too pressured to make a decision about plastic surgery. And it's too important a decision to just say, okay, do this. And so we waited. I had a double mastectomy, and every year I kind of kept saying to myself, I might look into it this year, I might do it that next year, and the 10 years have passed, but it's still kind of out there. When summer comes and other things, but even though I smoke and mirrors, as I call it, I am able to still look good on the outside. But it is, I have to say, breast cancer and removing your breasts and all of that is so devastating. And so I think it's been so personal, like both of you said, that really listening to women when they come in and hearing what works for them or what suits them is really the hallmark of being a good doctor. So I'm still flat, but the culture is changing, and I think that's what you're hearing now. There's groups like Flatties Unite, but the truth is, and Flat Fabulous Fashions, et cetera. I belong to a lot of groups, like support groups and online groups, and it's really important to know that you can be, you have to learn to love your body again, whichever way you choose to have it be, and get on with your life.
Oh, I agree.
And if I can toot your horn, if you don't mind, because we do see patients that come in for second opinions, and I'm blessed enough to be able to take them into the room. And I allow them to open up to me first, and I said, I I know, I walked on this journey.
Yes.
I'm with you. And when they walk out of here and they say, oh my God, I can't believe him. He was so wonderful. You have to have a team of doctors that work with you, that you walk out of an office and you can feel, oh, this is where I need to be. This is the team I need. If you have any doubt,
Yes.
that's not the right doctor for you, because you have a long journey in front of
Yes.
you, and you
Yes.
need somebody who's gonna be by your side.
And
Yeah,
if you're not
to-
ready to you can take some time and
Right.
come back.
Absolutely.
We've
We've had many
patients
patients that do that,
that
right?
come back later.
Right?
But you have to know that as an option as well.
Right.
And
Yes.
that has to be
Right.
told to you.
Absolutely right.
And then the other
Absolutely
thing
right.
that is new or newer is that, you know, a lot of women think, if I ask everybody in the room, what do you think about a mastectomy? Everybody thinks it's that long line, no breast tissue. And part of that's true, but Dr. Goldstein, mastectomies have changed over the years. And from the reconstructive surgeon, it's fantastic that the general surgery groups now that really specialize in that are really considering doing a great oncologic surgery, meaning you take out, you get rid of that cancer, you get rid of anything that you can, but you're conserving a lot of the skin. So kind of go through different mastectomies now that you do, because we've done some great ones together, and it's finally nice that it's coming in this direction, because it's been like dragging people along to try to get people to do that. So this is part of the education. Let ladies know that it's not always just, you know, a big long incision. And
Can you also touch on delayed versus immediate reconstruction? Because I think that's something, I know Mindy said she had delayed reconstruction.
And I had the immediate, which is
Yeah,
the
so
same
can you
thing.
kind of explain what that means?
I'll go into that. Yeah, go ahead.
Yeah, so I'll talk about more immediate reconstruction. So one alternative is removing the breast and leaving the chest flat, and that's a perfectly good alternative. It's comfortable, it's easier to recover from. Another alternative would be removing the breast, and if the tumor is involving the nipple and the ducts right behind the nipple, we remove the nipple. But if the tumor's not involving the nipple, frequently, depending on the size and the shape of the breast and the patient's general health, we can preserve the nipple, and there's a variety of ways to do that. In a smaller breast, we'll make an incision below the breast in what's called the inframammary crease and remove the breast tissue, and then Dr. Antimarino can come in and do a reconstruction, and he can talk a little bit about that. There's a variety of ways to do that. Sometimes, if in a larger breast, we can do a breast reduction. So we can't do this in everybody, but our goal is to make women look as good as they can, and sometimes even better than when they came in. So if a woman has very large, pendulous breasts, we can lift those breasts, usually preserve the nipple, and do a lumpectomy with that, or even do a mastectomy with those types of incisions. And those are very good options.
Right, and those weren't options a number of years ago. So again, it's sort of, you know, we talk about a lumpectomy being breast conservation, but you know, saving as much skin, so you know, we can do it as what's called a skin sparing. So you would just take the nipple and all the breast tissue with it, and leave the skin envelope, and then somebody, you know, the plastic surgeon come in and it's sort of fill that skin envelope, which is a really nice way of doing it, because again, now you're not trying to have to expand the skin, you're using that. If the nipple is involved, and then we've done this now, is to go through the full, like you said, and now the breast really does the envelope that you're looking at, and my job then is to sort of fill that volume so that it looks, and a woman looks very much similar to what she looked like coming in. So again, the mastectomies don't always have to be that long scar. But getting back to delayed versus immediate. So immediate reconstruction means that the reconstruction, at least the start of the reconstruction, because most reconstructions take 2 stages. But the first stage is done immediately at the time of the mastectomy. So the general surgeon and the plastic surgeon work together and do part of that reconstruction right then. A delayed reconstruction means that the mastectomy has been done, the tissue is allowed to heal, and just in Lisa's situation, it's allowed to heal, and then at some time later in her life, whether it 4 months, 4 years, 4 decades later, she can come in and say, okay, I've really been thinking about it now. I'm at a time in my life where I can, really think about reconstruction. And then we look at everything and then go through different options that she may have at that time. Preferably, I like the immediate reconstructions because a couple of things. Number one, there's less scarring. That's usually before the radiation treatments. And not everybody needs radiation, but radiation can cause a little bit more scarring. So from the plastic surgery standpoint, it's nice to have nice fresh tissue. You can expand it. You can have a little bit more options in your reconstructive choices that way. But the other reason is for just the psychological effect of going to sleep with both breasts, waking up with either a natural breast and a breast mount on the other side, or 2 breast mounts from the reconstructive. So lots of studies have shown that that's been a real help for women just from a psychological standpoint. So at any time somebody wants to talk about breast reconstruction, I'm excited to talk to them about it. But the options there may not be as many options in a delayed situation as there are in the immediate reconstruction. So that's sort of the difference.
Jamie mentioned that she found a lump. One of the questions we have is that they want to know, did anyone not find a lump, and what should they be doing to check their breasts if it's not found by finding a lump?
So we recommend that women do a self-breast exam every month, and the best time to do it, if you're still menstruating, is at the end of your period. So if you do it before your period, your breasts are swollen and tender, and if they're cysts, they're larger. So really waiting until the end of the period. And then in postmenopausal women, I tell them just schedule it. Schedule it the first of the month, or if you're born on the 10th, do it the 10th every month, or just schedule it. Now we have phones, we can put it as a reminder. And if a woman's had a mastectomy, they still need to schedule an exam a self-exam of their chest wall. So that's an important thing to note also. Most women don't find a mass these days. Most breast cancers are found on mammography. And we always say mammography saves lives, and we say it because it's true, because we find tumors at much earlier, smaller stages. And so for Jamie, was not really an option, because we don't do screening mammography on women in their 20s for a variety of reasons. But so in younger women, they do tend to find the masses themselves. But for most women, they're finding it on screening mammography.
Any other comments from there?
No, they're just people saying hello. They're listening in. Some of the questions that have been asked, you guys have already addressed, like nipple sparing mastectomies. People have asked about male breast cancer. So it seems like as they're asking, you're answering before I've even said it to you.
Have you, because I work with a lot of women and some men who've had breast cancer, have you had any men come in for reconstructive surgery?
I haven't. I've only had, interesting is that I've only had one gentleman in my practice with breast cancer. So, and maybe I'm wrong, but from what I've seen, the statistics for male breast cancer really haven't changed over the years. They've been pretty steady, but women are just going through the roof, and so it's kind of an odd situation that in one gender it's skyrocketing, but for men it's really not. Of course we have a lot less breast tissue, and we don't have
estrogen,
the estrogen pressure, obviously in the same amounts. But I don't know. I mean, I think
male breast cancer is very interesting.
Mm-hmm.
I'm very interested in male breast cancer. So for all women with breast cancer, about 2% of us will be carriers for the BRCA gene.
Yes.
But in men, it's 50%. So it's a much more common problem. So any man who has breast cancer needs to be tested, and if he's positive, their family members need to be tested. And if he's no longer around to be tested, we will test first-degree relatives of men. With a man, we don't really do breast conservation surgery. Once we find a cancer, we remove the entire breast. It's just what we do, and it's pretty cosmetic in most men. And men do not seem so disturbed by the asymmetry. if a man is BRCA positive, there are no guidelines what to do with the other breast. Whereas in a woman who's BRCA positive, the guidelines are to do a bilateral mastectomy if they choose to do that. In a man, there are no guidelines. However, we don't see that many, but in the men that I've seen who are BRCA positive, I strongly suggested a bilateral mastectomy, and I found pathology on the other side that was unexpected, like DCIS and other types of
What I've heard, and it may or may not be true, and this is the only reason I bring it up, is often men wait a long time to come in to see a doctor.
For any reason.
That's probably true.
It was sort of impossible.
And since we're talking about breast cancer awareness, I just want to encourage men that, I think there's so much that you can do reconstructive wise, if somebody wanted that or needed that, to not wait till it really becomes a big lump and they come in when it's progressed quite a bit.
What I see in my practice on the other side is a male gynecomastia, male breast tissue, and I've seen a rise in that, and I don't know, that's a slowly increasing. So you would think that would sort of parallel, or the breast cancer would sort of parallel, because if more men are developing breast cancer or breast tissue, that they would be a little bit more susceptible. And I'm seeing not the guys that I'm correcting, the gynecomastia are not, young guys, not in their teenagers.
Yes.
They're in their 20s, 30s, and 40s. So it's been there for a while, but you just don't see that increase, which I find fascinating, because with women, we're seeing women with larger breasts at younger ages now, and it's sort of like the breast cancer is just sort of riding right along with it. So I don't know what it is with guys. I don't know.
I'll tell you an interesting little factlet. So my father was a general surgeon who specialized in breast cancer surgery. His mom died at a young age of breast cancer, unfortunately. And so he was really touched by this. And he told me when I was a kid that men who get breast cancer are firemen because they wear suspenders. And it ends up, this was a myth. It's not true, as it turns out. It's not true. But it was the old wives' tale, and people felt if men had too much stimulation on their breasts, they would get cancer.
Oh, really?
Not true.
That's
interesting.
Yeah.
Throwing out all my suspenders.
Right.
Don't this is
Well, people say that about bras. I mean, there's some myths, there's a lot of myths, but one is that wearing certain bras can cause breast cancer. That's not true, is it?
No, that's not true.
Or not wearing a bra, because I have ladies who come in and they'll say, my grandmother said you had to wear a bra to bed every day, otherwise you're going to get these big breasts that are hanging down, you need a breast reduction, breast cancer is higher. I've heard all of that, and I don't know how that gets started, but I guess that's
Another
the same
myth
with
is
the...
some people think that if you have small breasts, you're less likely to get cancer. Also not true.
It's important to
Well,
know.
Jamie, didn't you say that?
100%.
I have a question about, can you talk about lymphedema after surgery?
So when we do a full axillary dissection, removing all of the lower level nodes in the armpit and the axilla, the risk of lymphedema is about 30%. Yeah, and maybe Lisa can talk a little bit about how that's managed and some options. But it's less and less common now when we do these sentinel node biopsies, which is what we're really moving towards, is less surgery in the axilla, not more surgery. So with the sentinel node biopsy, when we do just a lumpectomy, the risk is about 1 to 2%. And the risk goes up if you have lymph nodes with cancer, or if you get radiation on top of a lymph node dissection.
And what's the percent now that women are getting radiation to the armpit area?
So that's a complicated question.
Yeah.
When women sign up for breast conservation surgery, they're signing up for postoperative radiation. And that's exactly how I put it, because the risk of recurrence in the breast is about 30% without radiation, and with radiation it's about 5 to 6%. So if a woman tells me ahead of time she is not going to go for radiation, I do not encourage breast conservation therapy. Having said that, in women who are in their late 80s, 90s, sometimes we'll forego radiation therapy.
But do you find that those ladies have more lymphedema than the mastectomy patient who did not have radiation?
No.
These are just
It's a good
questions
question.
that I get asked.
Yeah.
But it's a great segue into, Lisa has her
Sleeve.
compression
Oh, it's
sleeve on.
lovely.
And we were talking about some of the clothing that you have, and
Yes.
you have access to on your
Yes.
website. So tell us about your sleeves. I love them.
Okay, I know they're from a company called Lymphedivas, and I started Cancer Be Glammed because, you know, I found I was not well informed about how to get on with my life, how to dress, how to just, you know, answers to problems like hair loss and weight gain and skin problems and all the things that when you're focusing so much on your medical recovery and then you wake up and it's like, what now? I wanted to put together a company that women could find great products, they could find terrific information, they could have a community of support for helping them deal with all the visible fallout from cancer surgery and treatment. I do have lymphedema, and I got it about a year after my surgery, and I had axilla surgery, and I have to say, that's more painful than the breast cancer surgery. Did anybody else have that?
Yes.
And I wasn't prepared for that. I don't think I knew that that's where most of the pain was going to come from, and that you couldn't lift your arms. And so really getting information out to women so they know what to expect when they wake up and when they're trying to live their life, that's really something that I like to do, and sort of jumped on and said, I want to create a company that will help women get on with their lives. So, and to find what we like to say, Cancer Be Glammed is practical yet fashionable. If there are ways to make it look good and incorporate into your daily life, that's what I'm trying to do. So this company was founded by a survivor. They have 50 different patterns. I mean, I change them daily, and it's really good. You know, it's a nice way to dress up and get away from just a plain basic beige sleeve. And so part of Cancer Be Glammed was to track down and find, as I said, fashionable yet practical products. And so a lot of these were invented by survivors, and I think that's what's really great, because they couldn't find what they were looking for, so they wanted to help other women and other people. This is a healing comfort shirt. It's for post-surgery, not just breast cancer surgery, heart, lung. And what's so terrific about it is it's Velcro, and you can put your drains in here. And one of the biggest requests we get from women on Cancer Be Glammed is drain management. And we feature shower shirts and all sorts of different clothing, camisoles, etc., that will conceal drains.
Does everyone go home with a drain?
That's a good question.
Everybody that I offer out. Yeah, but I think even when mastectomies, you do, because you're actually removing a lot of tissue. So there's a lot of raw tissue. Not to be too graphic, but you know, all that tissue, the skin needs to stick back down, and your body naturally produces that fluid. I usually give the analogy as like when you're a kid and skinned your knee and that sticky fluid would come out. That's what's being produced by your body, and the drain is an evil necessity because it has to whisk away that fluid so that it doesn't build up, and it allows the tissue to heal and not get that fluid collection. So the drains, although nobody likes a drain, they really are a necessity.
Mm-hmm.
But managing the drains,
Yes.
you know, and when you're showering and you have a drain in,
Brilliant.
it's
And
hard
there's more
to know what to do.
Totally. So and then if you go on cancerbeglammed.com, we feature, you know, we don't sell anything ourselves, but we picked out, we'd say we like to take the guesswork and legwork out of a cancer diet. We've picked out clothing options, etc., like this, and then you can purchase them from the companies. And this is, I really like, this is from a company called Radiant Wrap. And you know how depressing it can be to just go every day, day after day to radiation. I see big nods over there. And so this company designed custom, they consider them custom radiation gowns. And you get this terrific gown, and again, lots of different styles, colors, etc., that has been approved by a doctor. I'm showing this so well, and you can wear for radiation, and it comes in, this is what I really love, in its own little bag. So you can keep it in your purse, and when you go to radiation, you can just take it out, change into it. And again, it's all about taking some of the depressing medical sting out of cancer recovery. Nothing personal. No personal. And I love this. We showed this the last time.
Right.
This is for port access. And today, that's the difference between 10 years ago or 9 years ago, I would
Yeah,
imagine.
you guys were all looking at it thinking, I wish I had that, I wish I had that.
And it's
always
terrific, and there's different
whole shoulders
companies
out.
that carry them, but I really like this company. It's called Rebound Wear, and it's, you know, port access, it zips out all the way down the arm, which is important. You know, if you're having blood taken, you can zip it up and just unzip the bottom part. So that's really great. Last but not least, this is a company called Wrapped in Love, and we feature lots of different companies and not just for breast cancer, for all forms of cancer. And this, I'm not gonna be able to show this well, but it's a beautiful, lightweight sort of poncho wrap that, you know, if you're in bed and company's coming, I used to say I love to entertain from my bed, but you'd want a cover, put on a cover up that's nice. You can wear this when you go out, if you've got bandages, etc., and just feel good about yourself without having to feel like you're singled out as a sick person. And that's the whole concept of Cancer Be Glammed, to let you continue to live your life feeling the best you can about yourself.
Yeah, it's excellent, it's great to see.
Beautiful, great stuff. That's
See,
really
and everybody likes it.
Yeah,
Yeah, and wait, this is the best. This is an inflatable chemo bag.
You gotta show the bag, because I can't leave without showing you the bag.
And you blow it
Isn't
up.
that fun?
You blow it up so you can keep it in like a suitcase if you need to, going to the hospital, and you blow it up, and then it's inflatable. But you can, the nice part, and what we always recommend for women taking bags into chemo or anywhere, is if you can wipe them down,
Right.
because they can get very germy. That's my show and tell.
Well, there's so much information. Do you find, Mindy, I know you're very passionate about support groups and talking to women who survivors. What would you say would be your biggest piece of advice to someone newly diagnosed? Do you, I'm sure I can speak for you, but I'm sure you encourage patients to be a part of a support group where they have.
Yeah, not right away, because too much information is not helpful. I've had people just call me on the phone and just ask me questions, or you know, you might recommend someone that you know that has the same diagnosis as them. I went through the American Cancer Society, the Reach to Recovery, which was wonderful for me. They give you a Reach to Recovery person. Actually, I went through the training too. I was a Reach to Recovery person, but Denise Orr was my Reach to Recovery, and she was wonderful. But she said, take it one step at a time. Don't worry about your reconstruction before you even have your surgery. You know, don't worry about losing your hair or what you're gonna wear on your head before you know you're even gonna have chemo. So it put things into perspective for me. Now I did have to go through all that, but it did help. It was very helpful, not as a group, but as a one-on-one person. And they Reach to Recovery, they are trained to talk to you. You know, I mean, anyone can talk to you, but they're trained to know what to say, what not to say. And that was the biggest help for me. I have since, reached out to a lot of people in groups, personally, through work. Jamie, that's how Jamie and I met. She worked for one of our vendors, and I heard of her diagnosis and called her. A lot of times that just happens. That's just the way it is. And most people have all been touched by breast cancer by someone. So if you know where to lead them, it's a little bit better, I think.
Jamie, what advice would you give to someone?
Do not Google.
Well said.
You're right.
You're right.
That's what I did. That was my worst nightmare I could have done.
Was Googling.
Yeah. Because it's not my doctor. It's so much other stuff, and I had myself dead at 26 after reading everything, because you don't know. don't be afraid to, your friends, family, talk to me. Are you okay? Open up. Because, my best friend at the time, which is now my husband, he every day, every morning, good morning, beautiful. How are you? And I was always honest with him. And just don't let go of your support system. That's the best advice I can say.
Sherrie?
Well, perfect, that's so true. But for me, because the darkest moment for me was not knowing where it was going to go, what was going to happen. And then once I found out, once I was given all the information, I think really finding this a team of doctors who you truly walk out and feel, and you want to turn around and say, oh my God, thank you. Now I know this is where I need to be. That's who's going to take care of me. If you have any doubt, that's not the right team for you. It's just not. I mean, it's your gut. And I always tell my son, when your gut's talking to you, that's God or your angels telling you how it should be. Go with your gut. And when I walked out of your office, and I'll never ever forget, was my husband, and he said, if I have to come in at midnight to do your surgery, well, we're going to do your surgery. And just having somebody that I knew that was there and was going to take care of me. Stop! I'm not going to cry. I've been really making here. But you have to have somebody. It is. It's
I did not have a
important.
team.
Right.
Now, who pulls the team together?
I had a surgeon.
Is that something that after you are diagnosed by, who do you see first? Your primary care? Can you walk us through that process?
Oh, I'll let you kind of go
So
through
the
it.
first part of the process at Excela is the patient has an abnormal mammogram or has a mass on their breast, and they see radiology, and the nurse navigator tries to meet them at the time they get their biopsy. So she comes in, she meets them, she gives them her card, and when the results are back in a few days, she calls them with the results. And she is very highly trained. So usually we've discussed all the results. She's seen their mammogram, she's discussed with the radiologist, with me. And so it's our nurse navigator who starts with the woman on her journey. She takes her by the hand and leads her where she needs to go. The next step is the breast surgeon, the oncologic breast surgeon, and sometimes the oncologist if a woman needs to get chemotherapy first before surgery. And it's the breast surgeon who will determine and get the patient to go see a plastic surgeon. So some patients we know are not going to really be a very good candidate for reconstruction right away. Maybe if they're heavy smokers with multiple medical problems, you know they're not going to heal very well, and so maybe we will not make that referral if they're very old or if they're just not going to be able to get through the process. To get reconstruction, you have to be motivated, I think, is part of it. And then we go from there. So if I have a patient that's going to see a plastic surgeon, she'll come and see Dr. Antimarino, and then we'll talk on the phone or text each other or come up with some sort of a plan. Like, is this nipple sparing? Are we going to make a mid-breast incision? Should we do it in a waist pattern? There's a lot to talk about, what the best approach is. And then the day of surgery, the patient sees the plastic surgeon and me. We each mark the patient. We talk about it again. We make sure we're on the same page. We have the right plan, and then it goes from there.
Right, and the team has to work together. And the oncologic doctors work with everything that we're doing, and anybody on that team, the patient should feel comfortable with. And I think the team that's at Excela now is a good team. They really are, and I've been working there for a number of years now. And everybody seems to be really cohesive about the process of getting ladies through their journey.
Yeah, we have a multidisciplinary conference every Tuesday morning. The plastic surgeons are there, the general and breast surgeons are there, radiation oncologists, radiologists, pathologists, oncologists, and then all of our team, our PAs, our nurses, our tumor board members, and we discuss patients. And so it's like every patient is going to be able to get 10 or 20 second opinions. without having to show up herself.
Right.
When I tell a patient I'm presenting her to tumor board, I always have to reassure the patient they don't have to come and be examined. So we just present things and come up with a plan that works.
Now, do you share that with the patient, like you, did
Oh,
you
yeah.
just say? Sharon says Dr. Goldstein's nurse navigator is a wonderful liaison.
Yeah, I have a wonderful nurse navigator, Sheila Farina, and I really feel extremely blessed to have her as part of my team.
And that's key too. You know, I don't know if other places are doing that, but I think that's a key thing that Excela's doing, because again, now you have that one person who you've already spoken to, you guys have already talked about it. Now they're going to help that lady, because again, once you get that diagnosis, it's not like you're studying for an exam or anything else. This is something you have no idea about, and you don't have any idea what to do. So now you have somebody who can just sort of take you by the hand and say, "Don't worry, we'll get you through this," and just sort of help you navigate those waters. And I think helping you get through, as you mentioned several times, it's that fear of the unknown. You don't know what's coming next. You don't know what to expect, and that's the other thing I love about the Cancer Be Glammed, because you sort of have taken the, as you said, the legwork and said, look, this is what you should wear, this is what you should be ready for, bring this along, this might help you. So the more you're sort of prepared going in, the better you can sleep the night before, or the nights before going in, and you know, it's...
Well, you're making yourself comfortable too. You don't want to wake up and all of a sudden have to be in clothing or in situations where you're not comfortable. And so comfort and fashion essentially are a big piece of it. And what I've said to you before, we're not saying people should get dressed up, I think, or have to dress a certain way or have a certain cancer persona. But it's that women should have options. And that's what Cancer Be Glammed was about, is that to give women options. So if you'd like to wear a camisole that has drain management, here's where you can find that. And that's what we're all about. Knowledge is power. I know that's so cliche, but it comes out of my mouth all the time because it really is so true.
Heather says Dr. Goldstein has a way with patients that is second to none. My first visit with you, I knew I was in good hands. Love to you.
Thank you.
That was so nice.
I'm so glad you invited me.
I told you it'd be good.
This is very good for me.
Now, would you encourage patients to bring their support team with them when they meet with the doctors? Is this something?
Absolutely. I would. I mean, especially with the stuff that by the time they've seen me, you know, they have seen Sheila, they've seen Dr. Goldstein, they may have seen their gynecologist, their primary care, and now they come to see me. You're never going to retain everything I tell you, because my consultations are an hour to an hour and a half, because we've got to talk about tissue expanders and implants versus flat-based surgery, immediate versus delayed. We go through it, and you know, and it's just, you know, you kind of go through it, and I do it slowly, and you know, it's always nice to have somebody else there, because everybody else is picking up, and I really like it, honestly, is when the other person is writing it down, because even that person's only retaining parts of it, and we're talking about things that you've never heard of before. It'd be like me taking my car in, and I've got two mechanics telling me all about my motor. I'd be like, I don't know. You walk out of there, and I would get part of that, but I wouldn't understand the layman's, even their layman's terms. I wouldn't get it because it's not my field. So the more people you can bring, and as physicians, I can tell you, I love it if I walk into a room and with a patient there and multiple people, because I know that part is going to be taken care of, because that's the huge part, because that long journey isn't done by themselves. And we're a good support system, but we can't be the support system. And we can be a support system, but everybody needs a support system to help get you through it, other than us.
Is there any other words of wisdom any of you would like to share with our audience?
This is the worst thing that ever happened to me. I'm truly blessed.
We always say there's light at the end of the tunnel. There is. It's a journey, and I always told my son, out of every negative, there's a positive. You may not know now, or a week from now, a year from now, but something's going to come out. And like with you, you're able to talk to people, and you get that, and they have that aha moment, and that makes you think, this is what I was
Oh,
year
I was
4.
chosen. I was
Right.
chosen.
And
I
so, yeah.
truly believe that
Yeah,
God
you have to
chose
see it that
me
way.
to have this disease for a reason.
Yeah.
I wasn't being punished. I was chosen.
Sherrie's, that's a big thing here in the practice. Patients come in and they talk to her
It's wonderful.
Mhm.
and they connect.
Oh, absolutely. It's
Yeah,
true.
I think for me, and this is something I learned, and I say it often, cancer wasn't a gift. And that was one I'd like to return. I didn't feel like, okay.
You can't
this is
re-gift
going
it
right,
either.
exactly, no regifting. So cancer is not a gift, but I do believe the people it brings into your life are. And
That's so
that
true.
was a
Right.
stunner for me, the kindness of people,
Mhm.
the willingness of people to help and rally around you is just, it was life-changing.
Mhm.
That makes me cry,
Mhm.
you know, because people are amazing and want to help you and often go above and beyond,
Absolutely.
including like you, both of you know, wanting to really make a difference in that person's life.
Carrie says, my surgery is coming up and I have all the confidence in Dr. Goldstein and Dr. Antimarino.
Thank you.
Yeah, well, I'll tell you what, I mean, it's always, as I told you before, this was a special one, and now you can see why. Next month I'll say the same thing, but it still won't be as special. But for me, it was great because we get to hear everybody's perspective. Extra special because someone's here with me as a colleague who I truly respect, has been a great breath of fresh air for me, because she's really on no pun intended, the cutting edge of breast surgery, different type of mastectomies, different things that we can do, we can accomplish together. And not to take away from any of the other surgeons, there's all good surgeons over at Excela, and I've enjoyed working with all the other breast surgeons. But I think you're bringing that light to everybody, sort of following with you as sort of the team leader over there. At least that's my take on it. And so I appreciate you coming and being part of this. Lisa's always great because bringing that out.
Yeah,
this was
fun. Appreciate
And
it.
these special women, Dani had to leave, but it was nice for her to come out. So if anybody is really interested, Our Clubhouse is a tremendous support organization. Please get involved with them. I don't have the subject for next month yet. They keep me in the dark on that. But we do want to introduce 5 winners of the T-shirt giveaway. I had to write them down. There's no way I was going to remember this. Ruth Ann Kalinowski, Kathy Logan, Megan Ratty, Terry Geiger Hart, and Barbara Smith. So congratulations.
Message our Facebook page if you're a winner.
Okay. that's Liz. You want to show one of the shirts? Come on.
Great shirts.
Everybody's shy in front of the camera, but this is one of the shirts that you'll get.
That's great.
Okay. All right. The other thing is the last is the specials for the month. So every patient that comes in till the end of the month, that comes in for their appointment wearing pink, we donate $5 to Our Clubhouse. And also you can be part of the raffle for the free facial, which leads me into the Think Pink Raspberry Facial. So that's the special for this month, and you can enter to win that on our Facebook page. How'd I do?
Perfect.
Sounds amazing. It's like,
Yeah, it does.
pink raspberry facial. I like that.
Yeah, they always give me the hard one. But again, thank you so much for staying with us, and hopefully you'll tune in next month for a new topic. And until then, good night.